Finance Committee will come to order. Today the committee meets with Secretary Becerra to discuss the year ahead for the Department of Health and Human Services. There is much to cover, and I'll begin with telemedicine. This committee began to open the door to telemedicine in Medicare with a landmark Chronic Care Act authored with Senator Hatch in 2017. Then in 2020, we shoehorned telehealth services into the CARES Act. In implementing the law, Medicare decided to cover telehealth audio only on a temporary basis during the pandemic. That has been met with wide open arms from people across the country, especially in rural communities. In this year's appropriations bill, our colleague Senator Crapo and I pushed together to extend the audio-only flexibility beyond the public health emergency. There is, as you'll hear this morning, Mr. Secretary, bipartisan interest in building on the telemedicine progress. We want to make it permanent, and we want to make sure that we're not going to turn the clock back on patients who've come to rely on these critical services. I think you can count on plenty of discussion on that today. Now, Senate Democrats and the administration are committed to protecting bedrock health care programs, strengthening the Affordable Care Act, and upholding the Medicare guarantee. Sadly, Republicans in the Senate have other ideas. Senator Rick Scott, the campaign visionary for Senate Republicans, recently proposed phasing out Medicare in 5 years. I'm curious how America's 60-year-olds are going to feel about that one. Next, Senator Ron Johnson has doubled down on a longtime crusade, repealing the Affordable Care Act altogether. Senator Johnson says Republicans ought to be preparing their repeal bill now to have it ready to go when they take power. If it looks like it did last time, it's going to gut health care in America for tens of millions and shower tax handouts to the wealthy. That is not what Oregonians and Americans I'm talking to have on their mind. The biggest concern going today for millions of families in my state of Oregon and across the country is the rising cost of living. Bringing down health care prices and protecting Americans from getting clobbered by huge bills is one of the best ways for Congress to take some of the pressure on the pocketbooks, take some of the pressure off the pocketbooks of Americans. A couple of areas I'll highlight. For one, millions of Americans are getting a better deal on their health insurance this year because of the rescue plan passed in March of 2021. Monthly premiums for Americans who get insurance on the individual market fell by more than 22% this year, adding up to hundreds of dollars or more over more than 12 months. People across all income levels save money. 6 million new consumers got coverage. Go back some decades and Republicans would be shouting from the mountaintops about the incredible success of the private marketplace. Not so in 2022. These days, Republicans have gone on record against the tax credits that have made the success I just mentioned possible. If Republicans have their way, millions of Americans are going to get hit by higher health insurance premiums in 2023. That cannot be allowed to happen, and Democrats will keep pushing to make sure those savings continue. The administration and Democrats in Congress are also working in lockstep to bring down prescription drug prices. For so many Americans, every trip to the pharmacy counter means getting mugged by the drug companies. Instead of using the bargaining power of more than 60 million American seniors to get lower prices, Medicare's hands under current law are tied behind its back. Changing that by giving Medicare the authority to negotiate a better deal for brand-name drugs is the single most important reform on offer. Democrats also plan to cap copays for insulin at $35 a prescription and set an out-of-pocket cap for seniors' prescriptions in Medicare Part D at $167 per month. The plan would also create a tough new price gouging penalty for drug companies that increase prices over inflation. This plan also will save money for patients on Medicare and in the private market, and it's going to save taxpayers billions of dollars each year. So getting a better deal on health insurance and prescription drugs, these are the kinds of savings that on our side of the aisle we're going to insist on, not because of political reasons, but because millions and millions of Americans of all political views desperately need that help. Now, we've got to step up and deliver it. Finally, let me note the bipartisan work in the committee that is going on with respect to mental health care. As Senator Crapo and I have talked about often, this is one of the most important initiatives this committee has pursued, given the fact that there was a problem before the pandemic. That problem might be maybe here. After the pandemic, it has mushroomed, and we hear it from kids, we hear it from families, we hear it from seniors, we hear it in rural communities, we hear about it every time we're home. And adding Medicare coverage for seniors for sessions with a therapist or a counselor, getting rid of caps on Medicare coverage for care in a psychiatric hospital, the smart proposals that the Biden administration is making with respect to Medicare and Medicaid. These are all important efforts, and we're going to support them, along with waiving cost sharing for up to 3 mental health visits a year in Medicare and private insurance. And let me note, my seatmate here has been leading the Congress in expanding Medicaid funding for certified community behavioral clinics, and we are making a special focus on that as part of our bipartisan efforts in the committee. These proposals we're talking about, the proposals that are in the budget, the proposals that this committee is working on, are going to be a lifeline to people who are struggling to connect with mental health providers. You're going to get some questions on this for sure, Secretary Becerra, because members on both sides of this committee are laser focused on mental health care. We look forward to working with the administration on these issues in a bipartisan way. We want to thank you, Secretary Becerra, for being here. Lots to talk about. Senator Crapo.
Thank you, Mr. Chairman, and thank you, Secretary Becerra, for being here with us today. Our federal health care programs face a range of pressing challenges which demand serious solutions. Today's hearing provides a crucial opportunity to highlight both shared opportunities and priorities and concerns with respect to the proposals put forward by the President. As a part of our Cancer Moonshot Initiative, the administration has rightly acknowledged the value of multi-cancer early detection tests, which have the potential to boost the cancer survival rate while driving down costs. Earlier in this Congress, I reintroduced bipartisan legislation with Senator Bennett to ensure Medicare coverage for those screening tools, and I look forward to working with you, Secretary Becerra, to move this bill across the finish line. The budget proposal's focus on mental health also offers potential for common ground. Unfortunately, though, other aspects of the budget request raise substantial questions. It is imperative that we work now to keep Medicare strong, not only for current enrollees, but also for future generations. The Medicare trustees have repeatedly cautioned that the program's financial shortfalls will require legislative action, with the Hospital Insurance Trust Fund projected to reach insolvency in 2026. We have yet to receive this year's trustees' report, but the President's budget includes no proposals to shore up the trust fund's solvency. In fact, the document contains virtually no sources of Medicare savings at all, instead opting for a long list of coverage expansions, often with no cost estimates. Proposing dozens of new spending policies with no sense of their budgetary effect risks deepening the deficit and exacerbating inflation. A similar pattern persists for the budget request's Medicaid provisions, which would add billions in new spending without any meaningful cost savings reforms. Compounding these onerous impacts, the budget includes a placeholder for a reckless tax and spending package, presumably the nearly $5 trillion House-passed Build Back Better Act that was defeated on a bipartisan basis last year and rejected across this country. The government price controls, Obamacare subsidy hikes, and other misguided policies included in that bill would intensify the hardships that many Americans currently face. Under the package's price controls, we would inevitably see fewer cutting-edge treatments and cures, higher launch prices for new drugs, and a drastic decline in innovative R&D, once again handing the Chinese Communist Party a competitive edge. Long-term Obamacare subsidy expansions, meanwhile, would double down on skyrocketing federal spending and force taxpayers to fund coverage for Americans with six-figure salaries. These policies would worsen the economic outlook for working families. By continuing to push forward this problematic agenda, the proposed budget has missed a key opportunity to address urgent issues and needs. As states and healthcare providers across the country look to the budget for this year ahead, uncertainty abounds. The complex layers of flexibilities and coverage mandates tied to the public health emergency necessitate clear and comprehensive communication and accounting, particularly as stakeholders attempt to map out the path to post-pandemic normalcy. Without greater transparency, both for Congress and the nation, this process could prove unpredictable and needlessly costly. Coverage dynamics, for instance, will likely be volatile at the end of the public health emergency, yet this budget provides no plan for transitions in care. Last year's $1.9 trillion partisan spending bill suffered from poor planning and prioritization, with only around 1% of the package's funding directed to vaccines and therapeutics. This year's budget request provided a chance to chart a more thoughtful return to normalcy, continuity, and fiscal responsibility. Disappointingly, the document does not rise to that occasion. Secretary Becerra, I look forward to engaging with you on these and other issues in months ahead, particularly, as my colleague Senator Wyden mentioned, on telehealth, which continues to enjoy broad bipartisan support. Thank you again for being here, and thank you, Mr. Chairman.
Thank you, Senator Crapo. We're going to go to you, Mr. Secretary, in just a minute. I just want to make one quick comment about the trust fund, because this, I'm sure, is going to come up through the course of the morning. We all understand that we're going to have to work on this in a bipartisan way. So the question is, where are you going to start? Are you going to start with cutting costs, or are you going to start with cutting benefits? We've made it clear in our work with respect to prescription drugs, we're all in on measures to cut costs. That's where we're going to start. We're going to work in a bipartisan way, but we're not going to start with cutting benefits. We're going to start with cutting costs. Please go ahead, Mr. Secretary, with your comment.
Chairman Wyden and Ranking Member Crapo and each of the members of the committee, I want to thank you for this opportunity to discuss the President's fiscal year 2023 budget for the Department of Health and Human Services. Today, if I can start, more than 255 million Americans have received at least one dose of a COVID-19 vaccine. 2/3 of adults over age 65 have gotten their boost shots. We've also closed the gaps in vaccine rates that we usually see for communities often left behind. It has paid dividends to surge resources, including tests and treatment, to our hardest hit and highest risk communities. 325 million free COVID-19 at-home tests have been shipped. 270 million free N95 masks. From the $186 billion appropriated by Congress for the Provider Relief Fund, over 400,000 providers have received more than 766,000 payments for COVID services. Again, that's over 400,000 doctors, hospitals, community health centers, pharmacies, labs, nursing homes, and long-term care facilities, all receiving this critical support. That's real money, real relief, real results. Now, yesterday, I had a chance to meet with Medicare beneficiaries who are now able to purchase their over-the-counter COVID-19 test with their red, white, and blue Medicare card. Mr. Chairman, this marks the first time that Medicare has covered an over-the-counter test at no cost to beneficiaries. That's a game changer. Beyond COVID-19, today more Americans have insurance for their health care than ever before. And that, of course, includes a record-breaking 14.5 million Americans who secured health insurance through the Affordable Care Act. That's a big deal, as we know someone once said. Also today, the Biden administration is issuing a rule that will fix the health insurance so-called family glitch, which leaves out family members from affordable coverage. Less noticed, we launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 of our Afghan brothers and sisters resettle as refugees in America. And we're coordinating nearly $300 million in nationwide support for the launch of the 988 National Suicide Prevention Lifeline this July. HHS has also made key investments to close holes in our public health system in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby for from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in Americans' health. It proposes $127 billion in discretionary budget authority and $1.7 trillion in mandatory funding, including an historic investment to transform the mental health infrastructure in our country, a priority I know you share. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this is a no-brainer to prepare for the next pandemic. The funding we're requesting will be end-to-end for research, development, approvals, deployment, and effective response. Budgets represent not just dollars and investments, but our values and our priorities. This budget turns hardship into hope and inclusion into opportunity. And it's a commitment to finish the fight against COVID-19 and build a healthier America. Mr. Chairman and members of the committee, I look forward to working with you to make the President's 2023 budget a reality, to continue our efforts to give Americans real relief, real results, and real peace of mind. With that, let me yield back and answer any questions you might have.
Thank you, Mr. Secretary. And it is going to be a little hectic even by Congress standards this morning, Mr. Secretary, because we're going to be going back and forth on some procedural votes with respect to our outstanding nominee to serve on the Supreme Court. Mr. Secretary, I'm going to start with you on mental health parity. And we had testimony a week ago from leading experts in the field that private insurers, the big private insurers, are making a mockery out of the parity law. And you remember the history. We all looked at that and said, what Senator Wellstone and Senator Domenici have achieved will finally be justice for families. And this is something that member after member on this committee knows personally, as the Wyden family does with respect to experiences with family members. One of the really shocking aspects of this is the GAO, not a partisan organization, basically said that the insurance system is riddled with something they called ghost networks. Their words, not mine. Ghost networks. When you have a ghost network run by one of these big insurance outfits, you can't get to providers. You got a bunch of directories that are out of date and don't give you any information. And then the ultimate insult, their payments are so puny that the person is basically, in the family, is eating all the costs themselves. It just makes a farce out of the parity law, which of course said mental health and physical health would be treated fairly. What's the administration's agenda to take on these big private insurers? Because I think, Mr. Secretary, you and I worked together when we were in the Congress. Somebody is going to have to make it clear this is a priority, because they are using every trick in the book to get out of honoring the law. At the Oregon Health Sciences Center, for example, they had, during the pandemic, all these bills that didn't get paid. And I visited with them, and they said, well, the insurers said we don't have any people, and nobody can process a bill. So I met with the GAO, and the GAO opened an investigation. And then what a surprise. All of this money started gushing in to the Oregon Health Sciences Center. And we all laughed a little bit, but you almost feel like crying, because essentially you walked away from the judgment that these insurance companies wouldn't pay unless they got embarrassed by the local member of Congress in the newspaper. So what's the administration's plan? I know you're very interested in this topic, to really go after the big insurers, the big companies that make huge sums in the mental health field, and really crack down on these abuses.
Mr. Chairman, what you've just articulated, I believe, would probably be expressed by the vast majority of American families who feel this. And what the President has essentially directed us to do is figure out a way where we can to get some progress. So, for example, we're going to, in this budget, provide states with more money to enforce those parity laws so that they can actually go out there and do that. We're going to try to support states that are trying to move towards those parity laws in ways that are meaningful so that you have true services that you can access as a family member. We're going to try to eliminate the 190-day lifetime limit on psychiatric hospital services that are available to families under Medicare, working with you to do that. We're going to try to do what we can, like we did last year with the American Rescue Plan, where we put in a $3 billion investment in behavioral health services, half of it going to mental health services, half of it going to substance use disorder services, so we could prime the pump to get things moving. But as you said, today we know, as a result of COVID especially, families are really suffering mental stress.
Mr. Secretary, I'm going to let my colleagues ask their questions because time is so short this morning. I think all of those steps are very good and very constructive. I support all of them. I just hope you'll really hold some of these big private insurers accountable, because the foot dragging takes your breath away. I saw in the press the other day, one of them said, well, we're just coming around to the law, we're just getting adjusted to it. And you say to yourself, are you kidding me? This law's been on the books for 13 years. 13 years of foot dragging and excuse mongering is pretty much the order of the day. So I very much look forward to working with you on it. And let's really make an example. Make an example with 2 or 3 of these companies, and we'll be in a position to get some real changes. I've got a couple of my colleagues voting. Senator Grassley, you're next.
Thank you, Senator, and thank you, Secretary, for being here. The first is to thank you for allowing transitional health insurance plans to be sold next year. 65,000 Iowans will benefit from that. This is something I've urged you to do. These are farmers and small business people, and it's chosen to keep their health insurance that they purchased between 2010 and 2013. My first issue is about over-the-counter hearing aids. Thank you for your commitment to implementing this legislation by regulation, and the legislation that Senator Warren and I got passed to ensure that FDA finalizes the rules in a timely way and in a manner that Congress intended, not what special interest groups want. And I don't know how those special interest groups are interacting with anybody in the executive branch, but I sure know how 4 major players weighed in heavily not to pass this legislation in the first place. The comment period ended January 18th. Can you give us any date when these regulations might be out?
Senator, those will be out very soon. I can't give you the precise date, but pretty soon, and you can hold me to that. But can I just say thank you for giving us a chance to do this, because without the effort that you all undertook, we'd still be trying to fight to give our family members decent hearing aids.
It's obviously not your fault that it took 5 years, but we passed the legislation, I believe, in 2017 or else early 18. Now, the next question deals with, I don't know whether you're aware of it or not, but it took about 8 months to receive answers to our written questions from last June's budget hearing. And I know members of Congress that you would be frustrated with this. Could you commit to HHS being more responsive to our written questions?
Absolutely, Senator. As a former member of this body on the House side, I know exactly what you're going through. We've received over 500 letters. We've had to do more than 500 briefings in this past year. It takes a little while, but I'm committed to make sure we respond as quickly as possible and are as transparent as we can be.
According to the Medicare trustees, the Hospital Insurance Trust Fund is expected to be depleted 2026. Unlike the Obama administration budget request, the Biden administration provided no major policies to improve the solvency of the fund. Am I understanding that correctly? Does the President Biden have a plan to address Medicare solvency?
Senator, we're prepared, as I think Senator Wyden, the chairman, mentioned, to work with you on a bipartisan basis. We know that there are solutions there. We know there is bipartisan support for Medicare, and we agree with Senator Biden as well that, Senator Wyden, that it is important that we look at the costs, not the benefits of Medicare as we move to reform the system to keep it going for a long time.
Lowering prescription drug prices are on the minds of every member of Congress, and you and I have talked about my work in that area and doing it in a bipartisan way. We're 16 months into a new administration, and both houses are controlled by the Democrats. We haven't made any progress on this issue. I continue to meet with Democrats and Republicans to move a bipartisan prescription drug bill. Recent public comments suggest that the administration may bypass Congress and take executive action. Questions in regard to executive action: is the administration preparing any executive action on drug pricing? And if so, could you give us some details?
Senator, with 1 in 3 Americans reporting that they're not taking their medication because it's too costly, we need to do something. We certainly intend to use whatever available authority we have to try to lower the cost of prescription drugs, but we're also very intent on working with you on a bipartisan basis to get something done. This is one area where everyone agrees the cost of prescription drugs are way too high, and we have to do something. So we'll look to use whatever executive or available authority we have, but we hope that we can work with you to get something done in a real meaningful way.
Just let me make a statement in my last 10 seconds. I hope the administration would engage in a bipartisan way to pass bipartisan price reform legislation, and I would suggest a good starting point would be things that Wyden and I have worked on. Thank you very much.
Thank you.
Thank you, Senator Grassley. Senator Cardin.
Thank you very much, Mr. Chairman. Secretary, it's good to be with you. I want to start with an issue that I've raised before that I am pleased that is included in the President's budget, and that is the persistence of drug shortages here in America, which is kind of shocking when you consider the amount of resources we spend for prescription medicines in this country, far exceeding any other country. The recent study by the American Society of Health Systems pharmacists that there are over 200 prescription drugs that are currently in shortage. And these medicines are often life-saving and a cornerstone of critical care in hospitals and other settings. The FDA's authority to address drug shortages by requiring products to be labeled with the longest possible expiration date is something that I initiated with a legislative proposal, and I'm glad to see it's in the President's budget. The President's budget also includes $21.6 million for a resilient supply chain and shortages program. I want to just give you a moment to assure us that we can work in partnership and as aggressively as we possibly can. There should be no drug shortages in the United States of America. Many times, the shortages are simply an economic issue of the drug manufacturer rather than the ability to have the drugs available in our market. So thank you for the initiatives that are in the budget, but I hope that this will have your personal attention.
Absolutely, Senator, because as you said, this is an issue of not knowing that there's a drug out there. It's just not having sufficient supply. Part of it is supply chain. Part of it is the economics that drive some of these manufacturers to not produce as much as we need. Either way, we have no excuse to not have the supply of drugs that all Americans need.
I appreciate that, but I hope that you will focus on the way that we can make sure the supply chain is there with a carrot-stick approach, so that if necessary, we take action against the pharmaceutical companies with the power that we have to make sure that there is adequate production in this country. Let me go to a related point, and that is the President's budget includes a $200 million increase for the National Institute of Minority Health and Health Disparities. President Biden's been very clear about his commitment to deal with equal opportunity in America, including access to health care. In the Affordable Care Act, we legislated the National Institute for Minority Health and Health Disparities. It was our initiative, and I'm glad to see that there is a priority being set by this administration in its budget. But it goes beyond that. There are a lot of systemic challenges to equal access to health care in America that goes well beyond just dollars. So tell me your strategy to put a priority on the President's commitment for fairness in America and health care.
Senator, the fingerprints of fairness and inclusion are on everything we do now. Equity is critical. We saw that as a result of COVID, how many people we let fall through the cracks. And so one of the things that we did was, rather than wait for people to come to us, especially people who aren't accustomed to having access to some of these services, we went to them. And the result has been, when it comes to vaccines, the disparity that we used to see between white Americans who got vaccinated and people of color has disappeared. The disparity we saw in people applying for enrollment in the Affordable Care Act is beginning to disappear. And what we've done is essentially gone to people who aren't accustomed to having our government say to them, there's a great service out here you could take advantage of. The other thing I'll mention is that on the Affordable Care Act, for example, navigators, those that help people understand the process and what is best for them, we quadrupled the number of navigators we put out there so people could make a good decision. The result was 14.5 million Americans today have health insurance because of the Affordable Care Act.
And I would just point that there are multiple challenges to equity issues in getting access to health care, some of which go beyond your specific turf responsibility. And I just urge you to be a leader among the cabinet to address the equity issues. I want to underscore the chairman's point on telehealth. It works. We know it. People like it. It really does expand access. We have to break through the traditional barriers that we were able to do for COVID-19 and make those changes permanent. And there's bipartisan support in this committee and in Congress to make that a reality. So I just really want to underscore that. And then lastly, let me just mention dental care. It's an area that has been particularly important to me as a Maryland congressman with the tragic death of DeMonte Driver in 2007 for not being able to get access to oral health care. And we've corrected that for pediatric, but we have not yet for the general population, including the Medicaid population. And I know that the administration is working on this. We had our challenges in some of our discussions. But I would hope that we will look for innovative ways that we can expand access to oral health care. It's relatively inexpensive compared to the positive results we get from access to oral health care. And I hope that you will work with us to see how we can expand coverage.
Absolutely. I think we've learned that on that front, oral health care, we could do it, and especially with Medicaid, for pennies on the dollar.
Thank you, Senator Cardin. Senator Wyden and I are rotating as we have a series of votes on the floor, so I'll do my questions now. And Mr. Secretary, as we discussed yesterday, the current law mandates that the Medicare trustees release an annual report updating Congress and the general public on the financial status of the program, including the Hospital Insurance or HI Trust Fund. That report is due no later than April 1st of each year. Last year, with no real explanation, the report was issued 152 days late. It projected the HI Trust Fund would become insolvent in 2026, and we have yet to receive this year's report, which is now already late. Mr. Secretary, as a member of that Board of Trustees, do you know what the revised exhaustion date of the HI Trust Fund is?
Senator, I know we have the latest report, which said 2026. We are waiting for the staff to give us the report that would let us issue to the public the latest version of that report for the Medicare Trust Fund, and we will get it to you as quickly as we can. And look forward to working with you, as Chairman Wyden said, in trying to move forward with Medicare.
Well, thank you. And as a member of that board, I would ask you if you would urge them to get moving. At this point, we have no communication from the administration concerning the status of this year's trustees report. And following up on this, the Medicare trustees currently project that the trust fund will become insolvent anywhere from 4 to 5 years from now. And other than during the first few years of the Medicare program's existence, Congress has never allowed the trust fund to project fewer than 4 years of solvency without a legislative change. Acting early helps to minimize the overall impact on healthcare providers, taxpayers, and beneficiaries. Secretary Becerra, can you explain why the President's budget submission fails to include a specified package of Medicare savings proposals to address the trust fund's looming insolvency?
Senator, as you know, in the past, the President has submitted proposals to deal with the future of Medicare. In this particular budget, we have some items that deal with, for example, the incentives to have physicians participate in value-based payment programs that will help drive costs down. I think the important point is, as Chairman Wyden had said, that as we move forward in making reforms that improve and strengthen Medicare, we should be looking to reduce costs, not benefits.
Well, I certainly wish that the President's budget would have been much more focused on this trust fund, and I encourage you to work with me and with others to get that specificity outlined and implemented. I want to move to mental health for a second. I share the administration's commitment to address what the budget calls the invisible costs of the mental health crisis. That being said, for far too many of the policies that the administration has proposed, the cost implications are just that, invisible. Budgetary estimates and projections for a sizable list of provisions are just entirely unavailable. The budget includes $102 billion in new mental health spending, but that top-line figure fails to account for the bulk of the Medicare expansions outlined in the proposal, which would likely add billions, if not tens of billions, to this total. Where does the administration propose finding the savings from Medicare, Medicaid, and other programs needed to finance this new spending without further straining our deficit along with our state budgets?
Senator, first let me begin by saying that I think each of us here has not only the priority to deal with mental health the way we should have for a long time ago, but to make sure we have the resources to make it happen. The President has put forward proposals in the past. One of the things we'd like to try to do is work with Congress to make sure that we can keep this permanently in place. I can try to give you the details of particular proposals if you'd like, but what I can tell you is the President is committed to protecting and strengthening our efforts to try to have everyone receive mental health or physical health services in parity without any discrimination.
Well, because my time is limited, I won't ask you to go through those proposals you just suggested you could provide, but I would ask you to provide those. We really need that detail. Last question I have is on transitioning beyond the public health emergency. As communities across the country continue to return to normalcy, our federal policies should reflect that same shift. We learned a lot of lessons, which telehealth, for example, is one, on things that we should extend. But we need to give clarity on where we are headed as we try to deal with post-pandemic healthcare issues. That means putting an end to needless and invasive mandates, but it also means moving our healthcare system onto a more sustainable and predictable path. We just can't operate in a permanent state of emergency, and we need to move forward. With that in mind, our states, frontline providers, and working families deserve concrete timelines and plans for exiting the ongoing public health emergency, because we need a smooth transition. Given the omission of any direction along these lines in the budget request, do you expect the public health emergency to end this summer? And could you please speak to the administration's progress on post-emergency transition planning across programs?
You pointed out something that's critical for the American public and all of our industries, and that is the preparation it will take once we leave the state of public health emergency. We have committed to making sure that we give all providers at least 60-day notice of when we will bring down that public health emergency declaration. We are continuing to work to make the plans for what comes next. As I mentioned to you, the President has submitted a proposal and it's in the budget that would call for what comes next. So we go beyond COVID-19 to look at what might come next, the planning for that. We look forward to working with you on a bipartisan basis to make that happen. And what I can tell you is that everyone is seeing good signs of where we are today in COVID, in terms of Omicron, in terms of the number of vaccinations, in terms of the therapeutics that we have. Good signs. We hope that Congress will continue to work to provide us the funding that lets us have that happen all the way through this crisis. But what I can tell you is that as we move forward on COVID-19, regardless of what happens in the future with other pandemics or what we have to prepare for, but on COVID-19, we will telegraph to you and the rest of the public what needs to happen and as quickly as we can. As we've telegraphed that we need to continue resources to provide those therapies, those medicines, those vaccines that are needed by the American public.
Thank you. Understood. And I look forward to working with you, and I urge expeditious attention to this issue. Senator Stabenow.
Well, thank you very much, Ranking Member Crapo, and good morning. It's wonderful to see you. Mr. Secretary, appreciate so much all your work. There's a lot to celebrate and be excited about in this budget. I do want to start, though, and just say, as we debate the whole question of Medicare and strengthening Medicare for the future and solvency and so on, and I certainly support, I know the President does, strengthening, reforming, and moving forward to protect Medicare for Americans. But what we don't support is the Republican plan that Senator Rick Scott, head of the campaign committee for the Senate Republicans, put forward, which was to end every federal program in 5 years and then debate whether or not it should be continued, which, of course, is Medicare, Medicaid, Social Security, and so on. So, and that's been the platform put forward if the majority goes back to Republican next year. So I certainly don't support that. But I do support and want to thank you for the fact that you announced yesterday the over-the-counter rapid COVID-19 test at no cost for people on Medicare. I wrote a letter to you, urging that happened. Thank you so much for doing that. This is really important for our seniors and others on Medicare. No surprise, I want to talk about community mental health, addiction services. I have to say, when I saw this budget, I was literally jumping for joy, because this budget is historic in terms of finally making the investments and the priorities that we have needed in our country for a long time, and certainly need now after the pandemic, in community mental health services, substance use disorder services in the community. This is an area of great bipartisan support. I so appreciate the chairman and ranking member putting this as a priority. As you know, Senator Roy Blunt and I have been working for years to get comprehensive quality services in the community through our community behavioral health clinics, which the President has now embraced expanding across our country. And so I want to thank him and thank you for that, and wondered if you might speak about the clinics, particularly because there's so many things we need to do. Senator Daines and I are leading one of the work efforts here in the Senate Finance Committee on workforce, and we certainly know we need the people to be there. We need telehealth. We need a whole range of things. But if we don't have comprehensive services in the community to refer people to, if we don't have that available, we're never going to get anywhere. And so I was thrilled to see the new numbers that have come out that are even better than when we started a few years ago with the demonstration projects. But could you talk about how comprehensive community behavioral health clinics improve care, and why it's time to make sure every community has the opportunity to have these services?
Senator, to you, thank you for the years you've devoted to this. And hopefully through this budget, you'll get to see the fruits of that labor, and millions of American families will benefit as a result. What the President essentially said is, we're not going to treat this as business as usual when it comes to mental health. We have to take a different approach. And so he not only put forward a number of proposals to do this, but he also put his money where his mouth is, and he has committed substantial amounts of money, some $52 billion over the next 10 years, to transform our mental health system into one that actually provides decent quality care for all Americans who need it. And so we're going to work with you. We have a specific priority immediately to address the behavioral health issues for children. We're going to do everything we can to work with states to launch the 988 lifeline that hopefully becomes like 911, but for mental health services for those who are contemplating suicide. We want to make sure that really launches well, so we're working on that. We're going to continue to work with you to see if we can embed into our healthcare system the idea that mental health is no different than regular types of healthcare services. And it will take a lot of work, but behavioral health services, those where we go into community settings and we provide people with the opportunity to be cared for in their home or in their local community instead of being shipped off to some institution, that becomes critical, and that's where working with you. What we're going to try to do is make sure that we continue to bolster the support for those local facilities and supports, and we're going to also do everything we can in this budget to increase the salaries and wages of those who work in those community and home settings.
Thank you very much. And let me just say in conclusion, certainly Senator Daines and I are interested in working with you on the workforce issues that are very important to make sure we have the personnel, the providers, the professionals to work with people. But I do just want to underscore one thing. We've been working hard. We have now 435 quality clinics that are now funded the same as physical care, healthcare above the neck, the same as healthcare below the neck. And what is amazing to me is that the latest numbers show when you do that in the community, we have a 73% reduction in people going to the hospital, 69% reduction in people sitting in the emergency room because there's nowhere for them to get help, and a 60% reduction in time spent in jail. And so it's no wonder that the sheriffs and police chiefs across the country where we have these services are our biggest supporters. So we can save money, we can do the right thing, we can provide people these really important services. So thank you. I look forward to working with you.
Thank you, Senator Stabenow. Senator Cassidy, who is always very helpful in working on these health issues. Senator Cassidy.
Thank you, Senator Wyden. Secretary Becerra, nice to have you.
Thank you.
Secretary Becerra, as you know, the U.S. District Court for the Eastern District of Texas recently ruled that the rebuttal presumption of a benchmark rate in the interim dispute resolution of the No Surprises Act was invalid. The judge ruled that this, quote, conflicts with the unambiguous terms of the act, end quote. Now, as you know, the majority of my colleagues and I have been who wrote this legislation, have been sending you letters before and after the issuance of this rule that it violated congressional intent, clearly violated the plain reading of the law, and violated the kind of delicate balance we have between all the stakeholders to get them to agree. So on behalf of the administration, I guess I'm asking, would you commit to accepting the will of Congress and the courts and finalize a rule promptly that does not include a rebuttable presumption of a benchmark in the IDR, but rather follows congressional intent? And when can we expect that rule?
Senator, thanks for your interest. By the way, thanks for your advocacy on this particular issue on No Surprises Act. We have put in place guidance. The CMS has put in place guidance that has made clear that we are updating our documents and other materials in light of the Texas decision. But it'd be difficult for me to comment more since we are still in the midst of that litigation.
May I ask, will you be appealing that decision or accepting it?
That's a decision that will be made working with the Department of Justice. I can't give you that answer right now, but what I can tell you is that we're continuing to work through that litigation as best we can.
And I'm sorry, do you accept what the judge says, that it clearly violated the unambiguous terms of the act?
Well, as I mentioned, we've updated our guidance. We're doing everything to make sure we stay compliant with the law, and we will continue to proceed forward. We are implementing other aspects of the No Surprises Act that were not implicated by the court's decision, and we'll move forward making the decision where to proceed on that particular litigation.
Then let me go on to Medicaid, and specifically outcomes. Maternal mortality continues to be abysmal. Medicaid pays for 60% of births in our nation. And there's an old public health maxim, that which is measured is addressed. Now, we have a way to measure outcomes in Medicaid. It's called TMSIS. But it's my understanding that the method by which that data is presented to CMS is non-standardized. And indeed, different data sets are presented by different states, and some PDF and some digital, et cetera. So, and so I just gave the pregnancy outcomes, but I could give many others where Medicaid is not coming up to where it should. So, question is, what is CMS doing in order to kind of better standardize both the data that is collected and reported and how it is reported to make us better capable of viewing one state versus another?
Senator, you've touched on not a sensitive subject, but a subject that absolutely needs further attention. TMSIS is something that's been, as you know, in the progress for many, many years. We're trying to make as much progress as we can. We saw with COVID how important it was to have accurate data, and Medicaid is no different. We have to make sure we continue to work to ensure that the states are giving us the data we need so we can make decisions, and states can make decisions that make total sense. And so we look forward to working with you as we try to move forward with TMSIS and getting that taken care of. But as you know, moving these systems, these databases, into a different shell is difficult.
I accept that, but it could just be asking them to report the same issues. You know, if one state is doing this and no other state is doing that, then there's no way to have a comparator.
Yeah. And it's easy to ask. It's hard to get responses unless you have more than just a carrot to ask. And so we have tried. We learned that lesson with COVID, that some states have been very good about reporting data, even that data that they're not required to report. Other states have not. And it makes it difficult to make those full decisions, as you're mentioning.
So it sounds like this committee needs to give you some tools in order to address that.
We would love to work with you on that.
Sounds great. Next, I'm talking about mental health. Several issues. One is the RAISE initiative, which is the coordinated specialty care, which Congress has given money for. When I look at my own state, however, only 2 of my cities have actually begun it. And again, just for context, this is a wraparound set of services so that when a young person has her first psychotic episode, those services are there so that that first is her last. But apparently it is just so difficult to coordinate the different agencies that apply this so that it's had limited effectiveness and limited reach. So my questions are, what steps is the administration taking to increase access to the coordinated specialty care? And how is the administration prioritizing programs that serve this population like Medicaid and SAMHSA to work better together in order to achieve more people being enrolled in coordinated specialty care?
Yeah, and Senator, you're raising one of the areas where it's clear that we need to do more because there has not been that type of coordination, whether in the public sector side of healthcare or in the private sector side. And what we're trying to do, and that's why the President's budget reflects that priority, is make sure that we give everyone the tools, not just our agencies, but the private sector the tools they need to make it happen. We also put some requirements out there so that we can ensure that we're actually providing the care that people need. But
the coordination, because apparently it's so discoordinated, it's just not happening. And like Pogo said, we've met the enemy and he is us.
Yeah, no, it's very disjointed. And trying to get all those different stakeholders to work together, they'll tell you it costs money. We'll say it's going to benefit them and actually save them money in the long run, but it's getting them there. And we might need to provide some incentives to help push this along a little faster.
Okay, I yield.
Mr. Secretary, just on this point that my colleague has made with respect to the Medicaid data on postpartum care, I'm very interested in working with you and the Senator on this because we ought to be getting better data on it because the need is so urgent. We ought to be able to wring every bit of value out of those healthcare dollars.
And Senator, with the proposal to extend postpartum care to 12 months, we should be able to collect not only more data, but better data for a longer period of time.
That was almost going to be my next sentence, but you said it much better. Okay, Catherine Cortez Masto.
Thank you, Mr. Chair. Secretary, it's great to see you. Thank you for joining us. First and foremost, let me just say this. I've got to thank you and the administration for the clear prioritization of mental health in this budget. I am sure Debbie Stabenow said the same thing. It is one of the issues that I hear most from Nevadans, whether I'm talking with folks in the rurals about infrastructure or folks in Clark County about education. So often the conversation comes back to mental health. There's a lot in the budget to get to those concerns, including investments in workforce, expanded coverage of therapy, better enforcement of mental health parity rules are all proposals. I mean, there's a long list of it. And so I thank you so much for that. One thing I do want to talk to you about is the health crisis piece of it, because you talked in your opening about setting up the 988 hotline in July, which I think is fantastic for crisis, for people in whether it's a suicide hotline or in mental health crisis or any type of crisis to call. Let me ask you this. My biggest concern, though, is, and I know this is happening in Nevada, we want to set up the hotline, but once they call, where do they go? If we don't have a structure in place for services, essential services, to really provide for individuals in need. So can you talk through the investments in mental health crisis that you've proposed in this budget, and how will they help folks who need additional services on top of 988? In other words, at that crisis mode when they're calling, what types of services are you looking at? Because this is an area where Senator Cornyn and I have focused on providing and building up that essential crisis mode of services that we need, not only in Nevada, but across the country.
Senator, thank you for the question and for all the work that you've done on this particular subject. As you know, the current system is a patchwork. We have different phone numbers that people can call to try to get help when they're facing a mental health crisis or they're contemplating suicide. 988 is our way. Thank you, Congress, for helping us get these resources to bring it all together. It's almost one-stop shop. You get to make one call, 988, and if you're facing a point of perhaps considering suicide, you're going to get services. To your point, we're going to have call backup centers so that if a particular state is getting a lot of calls, there will be a backup center that will be available to take that call, so folks aren't waiting with busy signals or being put on hold to get services. I mentioned earlier in a discussion with Senator Stabenow how we're going to increase our investments in community and behavioral health services. We are investing in the President's budget more than $200 million to make sure that we can provide those local community health centers, mental health centers, to people so that there's a place where they can go. We can direct them if they do indeed have a mental health care crisis. So there are a number of things we're doing, but ultimately what we have to do is glue together all those folks who are doing this work throughout the country so 988 will work really well.
Well, thank you, and I appreciate that. The other thing, and I look forward to working with you. I know Senator Cornyn and I, this is an issue that we both care deeply about, and we've got to really address bringing the essential services to someone when they reach out through that hotline. One of the other areas of focus for us is to make sure that there's available to everyone insurance coverage to cover when they are reaching out through a crisis mode. So I'm hopeful, and can I get a commitment from you that you will be willing to work with us on our legislation to make sure we're providing those essential services right at the crisis mode when they're making that call?
Absolutely. We're committed to making healthcare, mental health care parity the law of the land.
Thank you. The other thing that I see and hear, not just in Nevada, but across the country, is the workforce expansion piece when it comes to behavioral health. There's an emphasis, I know, in this budget on the great work that allied health professionals do to keep their communities safe. It's especially true in behavioral health. Can you explain more about the provisions in this budget that would expand coverage of community health workers? Because it is something that I hear all the time that we need to do. And this budget and what this administration wants to focus on is really addressing that need.
Well, I mentioned more than $200 million that we're going to be investing in community behavioral health clinics to make that service more available locally to people. We are also in this budget proposing that we help states be able to provide better compensation to those who go into this workforce, in behavioral health workforce. It's often one of the most underpaid areas of coverage, yet it's one of the most indispensable areas of healthcare services. We're going to continue to work with those local programs that exist to offer them new innovations. We, for example, change completely. We're going in a different direction when it comes to how we treat substance use disorders. We want to go with the evidence. We want to go where people are. And we want to not only save lives, but keep people healthy. So we're talking a lot more about harm reduction, not just about saving a life.
Well, thank you. And I know my time is up, but it is essential because you're also opening the door for other specialists to be able to access and get services paid through Medicare. And these are folks that work in the behavioral health sector. So thank you very much. Look forward to working with you, Secretary.
Thank you.
Thank you, Senator Cortez Masto. Senator Menendez.
Well, thank you, Mr. Chairman.
Mr. Secretary, good to see you. The Maternal, Infant, and Early Childhood Home Visiting Program, known as McVeigh, is a critical resource for young families that improves maternal and infant health, school readiness, family self-sufficiency, reduces abuse and neglect, and it connects families to community resources and supports. It's an evidence-based program that has shown the real impact early intervention and support can make for young families. Unfortunately, the last reauthorization did not include a funding increase, and we know that just over 3% of high-priority families were served through home visiting pre-pandemic. While I'm pleased to see support for expanding McVeigh in this budget, my hope and goal is that this program, which members on both sides of the aisle support, sees a meaningful funding increase in this year's reauthorization. So can I have your commitment to work with me and all of our McVeigh champions on this committee to make the critical investments in this program so that families can continue to get the support they need?
You have my commitment, Senator.
Thank you. Let me turn to the question of Title 42. DHS intelligence officials are predicting an influx of migrants arriving at the southern border in the coming months. This is a seasonal trend matter, but also about the much anticipated end to Title 42. Title 42 is being used to evade our asylum laws. We have a law on the book. It is our international, not only our domestic obligation. And it was abhorrent under President Trump, and it's abhorrent under President Biden. Some of my colleagues who somehow think that it should be extended are making a huge mistake, because all Title 42 does is it has migrants making multiple efforts to cross versus knowing that there is finality in an adjudicated asylum claim. So how is HHS preparing for the likely increase in unaccompanied children that are arriving at our southern border this summer?
Senator, thank you for the question. We are in the process of projecting what our needs will be. I want to thank you and the members of the Senate and the House for providing us with additional resources to deal with the unaccompanied children who have come into this country, who are going through the asylum process. We have stood up as many of the licensed facilities as we can. Those licensed facilities that care for these children are separate and distinct from the care facilities that offer services, for example, in foster care to our kids from America. But we have worked with that universe of licensed care providers to make sure we can offer these children during their temporary stay with us the best care we can afford to provide them. At the same time, we do prepare, in the event that we have to stand up additional facilities, those that can provide the emergency care necessary so that DHS, when it must transfer those kids over, will have a place where they can stay temporarily.
So let me ask you in that regard. Last spring, very concerning reports emerged regarding the conditions for unaccompanied children housed in HHS emergency intake sites. And at that time, the department officials expressed their intention to depopulate and close these short-term facilities as soon as possible. However, as of April 1st, there were still 2 emergency intake sites open, housing approximately 2,100 children. Is the department still committed to closing these emergency intake sites and placing unaccompanied children with long-term shelters in your licensed care provider network?
That is the goal, Senator, because it's required by a court decision as well. And so we make every effort, every spot, every slot, every bed that we can find that is under a licensed care facility, we use. And because we don't have sufficient numbers, in previous years, many of those licensed care facilities disappeared because the system was dismantled by the previous administration. We have worked hard to build it up to increase the number of licensed care facilities, but when there aren't enough, we still have the obligation to care for these children. That is when we do stand up those emergency facilities.
Okay. And then we have a commitment by the president to give refuge to 100,000 Ukrainians. Is the department making preparations for that as well?
We are, Senator, and thank you again for the resources to make that possible. Just as we provided that refuge for the 68,000 or so Afghani refugees who've come through. We will be prepared to do the same for those who come from Ukraine.
I'll close just simply by saying I'm disappointed that our COVID package does not include any international assistance. We cannot meet the President's goal of helping to vaccinate 70% of the world by September if Congress doesn't include any amount for the Global Vax Initiative. And, you know, diseases and viruses know no borders. We can't hermetically seal ourselves off. It's in our own interest to do this, and I hope you and the administration will continue to advocate for it.
Senator Menendez, before we go to Senator Carper, let me just say I very much appreciate your points, and especially that last one. The fact of the matter is the main street in New Jersey in a community or the main street in Oregon in a community is affected by these health practices that go on around the world. The world keeps shrinking as a result of modern communications and modern transportation. And even if you don't accept the moral case, which you and I think, feel strongly about, just from a financial standpoint, a purely financial standpoint, it's just urgent business to make sure that these international health programs get funded because they affect our main streets, and I appreciate it.
Chairman, I couldn't agree with you more. This is national interest and national health security interest. So to me, in my operation, in my office, this would be what we call a no-brainer.
Yep. Well said. Okay, Senator Carper, I think you're online.
Mr. Chairman, Tom Carper, am I up now?
We can hear you, Senator Carper.
All right, thanks so much. I'd like to start off just a quick refresher on the Affordable Care Act for those who maybe don't know or don't remember. In 1993, then Republican Senator John Chafee introduced legislation that proposed an individual mandate and the establishment of insurance pools. That bill looked a lot like the Affordable Care Act. In fact, it had over 20 Republican co-sponsors in the Senate, some who still serve today, including on the Finance Committee. Fast forward to 2009, my first year as a member of the Finance Committee, and the first year of a new administration. Our new president called Democrats and Republicans to try anew to achieve what the previous presidents talked about doing for more than a half century. But instead of coming to the table and pursuing a productive discussion about how we could expand access to health care for millions of Americans, in the end, Senate Republicans chose not to engage. But the president and the rest of us soldiered on and finally passed this historic law. I might add, Mitt Romney, who was then governor of Massachusetts, actually took the handoff from Senator Chafee, and it was 20-something Republicans, and actually created in the state of Massachusetts Romney Care, which is very much consistent with what we've done with the ACA. I'm to be the first to admit the Affordable Care Act is not perfect. Very little that we do around here is perfect, but it wasn't when we first passed it. But our challenge has always been, how do we improve the healthcare system for more Americans? And as a result of the ACA, we were able to establish marketplaces in every state where people who didn't have insurance could get coverage on the exchanges. Folks who are low income could benefit from a sliding scale tax credit. Another important provision said if you're a healthcare insurer and you want to stop people from getting covered because they have a pre-existing condition, you can't do that. You just can't do that. That turned out to be a big part of the foundation of the Affordable Care Act. And the stuff that our Republican friends are most critical of is, to be honest with you, a lot of their stuff. So go figure. Secretary Becerra, in your testimony, you mentioned that a record 14.5 million people signed up for the 2022 health coverage during the last open enrollment period. A little over a year ago, President Biden signed the American Rescue Plan into law, which continued to make coverage through the ACA more affordable, with families saving an average, I think, about $2,400 on their annual premiums, and 4 out of 5 consumers finding quality coverage for under $10 a month. Think about that. 4 out of 5 consumers finding quality coverage for under $10 a month. The ACA, and guess what? The uninsured rate has fallen as a result. Big plus. The ACA was not perfect. It took a while, but it worked, and millions of Americans have benefited because of our efforts to better our healthcare system. And there are still ways we can continue to fix it, and hopefully Democrats and Republicans are working together. Mr. Secretary, again, welcome, but would you elaborate on how the President's budget request continues bolstering the health insurance marketplace to ensure that every American has the opportunity to seek out health coverage that works for them? Mr. Secretary, welcome.
Senator, thanks for the question, and thanks for all the work and the things you just pointed out. We're going to continue to try to break records when it comes to the Affordable Care Act. The President has proposed the continued work to have navigators out there to help those Americans who didn't sign up for a plan, and a very affordable plan, as you just pointed out, under the Affordable Care Act's open enrollment periods. Last year, the President extended a special enrollment. We got over 3 million Americans to sign up who hadn't signed up before. And during the most recent open enrollment period, well, we saw, as we said, the record number is 14.5 million. We're going to continue to work on that. We're going to continue to do the work we can, as you may have heard, on mental health, how we try to expand services there, and behavioral health services. So we're going to continue to try to take this to a different level where we know that there are Americans who still don't have coverage, aren't getting the services that they need, and as a result of COVID, suffering. We look forward to working with you, but the President's budget makes historic investments in areas that have far too long been neglected, including, for example, in Indian healthcare services, where for the first time, you're seeing a budget that not only proposes to make that funding mandatory so there's never a drop in services, but also do a long-term 10-year commitment to get us where we really should be going.
And one last quick question. Last month, you and Secretary of Education Miguel Cardona launched a joint department effort to expand school-based health services, something that we're big on in Delaware, ensuring that children have the health services and supports necessary to build resilience and thrive. It's clear the budget demonstrates our shared commitment between the administration and Congress to tackle shortfalls in mental health care on a bipartisan basis. My question to that end, how can Congress partner with the administration to better provide resources and support for schools? How can we provide further guidance on the federal funding available for school-based physical behavioral health services, including how Medicaid can support the delivery of these services? Just briefly, please.
Sure. The President has asked us to work and coordinate so that we're not doing things in separate silos. So the Department of Education and HHS are working together to make sure children have access to the best services they can, oftentimes in schools. And we'll look forward to working with you because those schools are in your states, in the congressional districts. You know best how to make sure that that happens, so we'll work with you.
Yeah, colleagues, and Mr. Chairman, and the state of Delaware, when I was governor, we decided to put a school nurse in every public school in Delaware. We also decided to put a wellness center in every high school in the state of Delaware. And we're now putting wellness centers in our junior high schools in the state of Delaware, all of which works in, and we partner with the local community, the school district, and the federal government on this. Find out what works more. Thank you, sir.
Thank you, Senator Carper. Senator Warner is next.
Oh, thank you, Mr. Chairman. I see my good friend Tom Carper there going through his litany of achievements as governor. I will not try to match him on that. Oh, I've got some good stories as well. Secretary Becerra, it's great to see you at least remotely, and I want to thank what you and the administration are doing on dealing with the family glitch on the ACA and the good work we've all been trying to do on implementation. I want to hit a couple of subjects fairly quickly. One, first is cybersecurity. This is an area I've been deeply involved in. I chair the Cybersecurity Caucus. The chairman here is a great member of the Intel Committee where I'm the chair. We've been working and we're slowly moving forward. We finally got some de minimis security requirements in for Internet of Things devices. We recently passed and signed into law a cybersecurity reporting requirement. Literally only 30% of the cybersecurity incidents are even reported to the government. And that's not to expose. We give confidentiality to those individuals reporting and some limited immunity. We got to make sure we can share with other members of the private sector to get this kind of word out. And I think we can all expect, unfortunately, still to see Russia activate some of its very real cyber capabilities in the coming weeks and months. So I'm going to talk about cybersecurity as it deals with the healthcare field. Obviously, this is extraordinarily sprawling. I find that I've been working on some comprehensive legislation here to look at cybersecurity in the healthcare field broadly. So, Mr. Secretary, I'd like you to not talk about what you're doing as Secretary to protect HHS's assets, but more kind of how HHS can work with all of the providers, hospitals, other pieces, the device manufacturers. There's a long litany that makes up the healthcare field, and particularly when we think about all of the smaller, many case legacy devices that may have some cyber vulnerability. What do you see as HHS's role in this, and how do you coordinate with CISA and all of the other various components that are grappling with cybersecurity?
Senator, great question, because most people don't think about this. At HHS, one of the things that we're trying to do is move everyone, not just HHS, but everyone in the private sector as well, towards risk-based decision-making, that they're taking into account what might happen, not waiting till it does happen. We're asking people to take a look at what's already been done. There are a lot of best practices that we can learn from that won't cost that much to deploy, because somebody else spent the time and made the investment to make it happen. And I think you can help with this, the Senate and the House can help with this, to make sure that the administration, we can provide incentives in the private sector to move people in a particular direction, to get them to think more about this risk-based decision-making model. And so there are a number of things we can do. Look forward to working with you.
Yeah, I'd like to pursue that, because I think we particularly see smaller hospitals, rural hospitals, sometimes make the trade-off that cybersecurity isn't that important until they get threatened with ransomware and then end up paying a much higher price. And that kind of merges into my next question. And I think this question was also raised by Congressman Fleischman of Tennessee in your House hearings. And this goes to the area wage index questions. We see a real challenge about providing rural health care in smaller hospitals. I know the chairman's got the same problem in Oregon. CMS has during COVID provide some relief, but as you know, that's now being challenged in court on dealing with the area wage price index. I've got legislation, bipartisan legislation, that would increase the Medicare reimbursement rates for about 850 rural hospitals around America. Many of these hospitals otherwise might be faced with closure. We've seen a dramatic increase in the closure. On this wage index, to kind of bring it a little bit closer to suburban and rural rates. I know you got asked this and are supportive of rural health, but is this an area where CMS could do it on its own, or do you think we actually need the kind of legislative bipartisan fix that I proposed?
Our authorities are pretty expansive, but someone's always going to take the time to challenge us in court. It really does behoove us to try to work with you in Congress to try to make sure that we address this the right way. We are making specific investments into rural communities on healthcare, but what you're speaking to really is it's across the board, trying to make sure that we do this the right way. So we would look forward to working with you on this.
And Mr. Chairman, I won't get to my last question. I just do think that this legislation needs to review at this committee. It would produce that national wage floor minimum, and I think that's one of the ways we can guarantee rural health going forward. Thank you, Mr. Chairman.
Thank you, Senator Warner. We'll be working with you on these rural hospital issues. Senator Barrasso, I'm going to run and vote. You're next, and Senator Crapo's back, so I appreciate all my colleagues' cooperation on a hectic morning. Senator Crapo, Senator Barrasso's next.
Thank you very much, Mr. Chairman. Mr. Secretary, thank you. I wanted to follow up on something that Senator Crapo asked a little earlier, and that's in terms of the Department of Health and Human Service implementing several emergency waivers for Medicare and Medicaid programs in response to the COVID-19 situation. Some of the waivers have granted patients more flexibility, like enhanced access to telehealth. Others have ensured that providers can do their jobs with less red tape and with more financial certainty. All those things are positive. The world today is very different than it was when the virus first hit our shores. Cases, deaths, hospitalizations are right now much, much closer to pandemic lows. This is why in Wyoming and most of America, life has returned to normal. I think it's why we must plan for the end of the public health emergency. And for us here in Congress, that means we need to ensure that providers and patients don't unexpectedly have the rug pulled out from under them after these flexibilities that I think have been helpful in Medicaid and Medicare after those end. So will you commit to providing detailed and specific information to Congress on those emergency flexibilities that you did use in Medicare and Medicaid and the CHIP program as a result of the pandemic?
Senator, absolutely committed to working with you because a lot of those authorities will vanish, and we need to work together to make sure we deploy what we know has worked.
So, and will you provide detailed information on emergency waivers that your department believes Congress should extend or make permanent beyond the public health emergency?
We look forward to working with you on that as well.
Great. Additionally, has your department specified plans to ensure that providers and patients are aware of some of the changes to Medicare, Medicaid, and the CHIP programs when the emergency actually ends?
We have, Senator, but you know what? You could help us a great deal if you continue to let your state leaders know that we're trying to make sure we're communicating everything that's around the bend. And so whether it's the Medicaid wind down or whether it's what happens to those authorities we have for telehealth, we want to make sure everyone has full sight, and we're working together to make sure we accommodate.
And Senator Warner before me talked about rural hospitals, and I want to continue on that because, as you know, I practiced medicine in Wyoming for over 20 years, and we've discussed previously ensuring patients in rural America have access to health care in a very it's a personal priority of mine that make sure people get what they need in rural communities. And rural hospitals have really been on the front lines of the pandemic. The facilities provided essential care when their communities needed them the most. And despite their best efforts, many rural hospitals continue to remain under threat. According to the University of North Carolina, 19 rural hospitals closed in 2020. 138 have closed since 2010. And the closure of a rural hospital means people have to drive much longer distances to receive essential health care. In a medical emergency, when seconds count, driving these long distances, and most certainly in the dead of winter, can have deadly consequences. And when a rural hospital closes, it really has a significant impact on both the health and the economy of the local community. When a rural hospital closes, much harder to attract and maintain businesses, teachers, doctors, all sorts of things, the impact on the community. So I'm concerned that your budget doesn't contain a comprehensive strategy for halting these rural hospital closures and building a sustainable rural health care delivery system. Can you discuss with me, please, how the department's going to address this critical issue of rural hospitals?
Senator, let me try to persuade you that there is not only an investment made in this budget, but that there is a plan here. Let me, for example, mention the $374 million that we include in the budget that would be used specifically to improve access and quality, as well as coordinate care in our nation's rural communities. We are investing more money in trying to train those healthcare practitioners in rural settings. So we're giving money more to some of those rural community facilities that could then house those future doctors, future nurses there. We know this from the studies that if you start your practice in a particular community, you may end up staying there. And so what we want to try to do is drive people that are going through medical school and so forth into some of these rural communities so that they start practicing there and hopefully they stay. There are a number of other investments that we're making, but clearly with the Provider Relief Fund support that we got from Congress, we've been able to try to shore up a lot of our community healthcare clinics, our hospitals in some of these rural settings.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Thune.
Thank you, Mr. Chairman. Secretary, earlier this year, a number of colleagues and I sent a letter requesting that you rescind a rule that requires everyone in Head Start facilities to wear a mask, including children 2 years old and older, even when they're outside on the playground. Though there is an injunction against this rule in several states, the rule has yet to be withdrawn. As the administration plans to drop Title II public health measures at the border and continues to modify other recommendations, why hasn't HHS decided to rescind this Head Start rule?
Senator, thank you for the question and your interest. Most of those kids in Head Start haven't had a chance to get vaccinated. There are still families that are very afraid of what could happen to one of their loved ones. Those who say that children don't get COVID should talk to the hundreds of families across America who've lost a child under the age of 5 as a result of COVID. We are driven by the science when it comes to the work that we do on COVID, and we will continue to do everything we can to make sure we're protecting every human life in America, including our children.
The transmission of COVID-19 is really low among kids, particularly young kids. And it seems like masking toddlers on the playground seems completely unnecessary, and I would say that even the World Health Organization has concluded that there isn't any particular benefit, health or safety benefit, to masking kids under 5, and especially when they're out on the playground. I mean, it just seems to me, at least, when you're outside and kids are playing, we know there are impacts, adverse impacts to masks when it comes to their socialization skills and to their learning skills. But it just seems like when you even have the World Health Organization saying that masks for toddlers or for children under 5 isn't necessary, that we are really creating problems that don't need to exist. So let me ask you this. When do you foresee that rule being rescinded?
You're talking about the public health emergency or the masking?
Masking, yeah.
So the masking requirements and the instructions on and guidance on that are, as I mentioned, are driven by the science. When our scientists tell us that there are needs to take precautions because masks have been proven to be safe and effective, we issue those guidance, sometimes requirements to move in that direction. Once we see that the need for those types of protections are no longer necessary, are no longer there, we will move forward in trying to make the adjustments. But while there's a chance to provide the most safe and effective way to keep a loved one alive, we're going to do that.
Well, again, I mean, not to overstate this, but it does. I think to me it just seems illogical, and particularly given when you weigh the consequences of the impacts on these kids, the negative and adverse impacts on these kids from wearing masks all the time, relative to when you try and weigh this, it's on the scale. It just seems like it clearly comes out on the side of common sense dictating this. I understand you're wanting to follow science, but you do have some scientists. You have the World Health Organization telling you that masking for children under 5 isn't necessary. And so it strikes me, at least, that this is one of those requirements that is just a real overreach at a time when parents, a lot of parents at least, and a lot of kids are struggling and struggling with learning. They've gotten behind. And I think a lot of it has to do with, associated with the impact of masks and their ability to socialize with other kids, and also to be able to learn at the fastest rate possible. So I would just, I urge you, encourage you, given where we are with the pandemic, that this is one, particularly when kids are on the playground, when they're outside. That makes no sense to me. Very quickly, because I don't have a lot of time, but we talked last year at the budget hearing about department's authority and resources to ensure the advancement we've made on telehealth during the pandemic, that those aren't lost. And I see again that this budget doesn't describe administrative actions the department plans to take on Medicare telehealth, nor does it include a full legislative proposal for Medicare. There is a single reference to extending pandemic flexibilities, but we need data, we need details on what you can and plan to do administratively so we can focus our efforts accordingly. And it would help to have more certainty on the expected length of the emergency for sure. But can you tell us some specifics on what you foresee the department doing administratively on Medicare telehealth at the end of the emergency?
Absolutely, Senator. Let me start by saying first, thank you for extending for 5 months the authorities we have on telehealth. We'd like to work with you to extend coverage for services for patients to be able to use their home as the originating site for that healthcare service. We'd like to continue to offer those federally qualified health centers and rural health clinics the ability to provide the services from distant sites. We'd like to move towards payment parity for behavioral health telehealth services so that we can continue to have providers willing to do that, that there's strong evidence that telehealth has been effective or just as effective as standard in-person treatment in parts of the country. We'd like to be able to do audio-only access for patients whose circumstances would necessitate that they get audio services instead of having to worry about trying to reach a particular provider in person. So there are a number of things we'd like to do. Again, with the authorities that you could grant us, we could try to keep those extended services in place.
Okay, my time's expired. Thank you, Mr. Chairman.
Thank you. Senator Whitehouse.
Thank you. Welcome, Secretary. Good to be with you. A couple of quick topics. First, the most significant issue that our Rhode Island hospitals are facing right now is nursing and healthcare workforce. And this has two dimensions. One, they're unable to operate at full capacity and are having to stop procedures because they simply don't have the workforce to operate. And second, because of the, I would call it a plague of contract nursing, they're having to spend spectacular amounts of money for services that didn't cost anywhere near as much before. What are you doing to help hospitals who are facing these twin pressures? Should there be some form of special reimbursement for the added nursing costs so we can get them back on their feet again?
Well, one of the principal tools that we've used for some 440,000 providers throughout the country is to provide them with reimbursement of some of their claims relating to COVID. That provider relief fund, which you and your colleagues helped put in place, $186 billion worth, has helped us provide substantial support to some of these facilities who are suffering from some of these conditions. Unfortunately, that
they kind of burned through that, so now and the problem is still there.
It makes it tough because.
Would you mind following up with treat that as a question for the record and let me know what?
Of course. We look forward to working with you
planned.
we need authorities and resources to continue to help some of those providers.
With respect to support for people who have addictions, we've always done prevention. We've always done treatment. It was only through CARA that we started providing recovery support. And because it had never been done before, we're kind of in a stranger in a strange land with no real guideposts as to what works and what doesn't work. Are you comfortable with the degree of flexibility that you've allowed for the recovery services to let people find their way, since there isn't a huge track record of success and data because we've never funded this before?
Senator, you touched on something very important, the data, the evidence. And usually at the federal level, we're the last to try to move in a direction that could help save a life or keep someone in better health. But what we've done with our new strategy on drug use is move away from the old paradigms. We are letting go of some of those taboos. We're looking at the evidence. And so, for example, for example, fentanyl strips. Some people say if you give people access to a fentanyl strip that lets you determine whether the drug you're about to take has fentanyl in it, which has caused some of the largest number of drug overdoses that we've seen, not suicides. That helps promote drug use. We think it helps promote saving of a life. The evidence shows it. So we're going to go in that direction. Clearly, we're going to try to help those who are moving in a faster direction to help treat. But we're also going to.
My point is, I think it's important to be flexible with the recovery stuff because people are having to kind of learn while doing and report in. And later on, when there's a body of research that shows what works and what doesn't work, then I think you can narrow the aperture a little bit. But right now, I hope you continue to provide support because it's always been underfunded before.
We're moving as best we can.
Last point, you focus in the budget on what you call program integrity
voted on the second one.
efforts, which have been around for a long, long time. I was the U.S. Attorney in Rhode Island, and Attorney General Reno put healthcare fraud and program integrity at the top of her policy priorities. And it's been at the top of policy priorities for a long, long time. And I worry that there's just not a whole lot of there because it's been focused on for so long. And once you actually get into the cases, they're hard to make. Yeah. So I think putting that as a priority with respect to lowering healthcare costs is a strategic mistake compared to focusing on delivery system reform, trying to get away from fee-for-service, trying to expand ACOs, trying to make sure that quality metrics are in place across the system. I think that probably fee-for-service is the biggest monster that is driving healthcare costs right now. We talked a lot during the Obama administration about the triple aim, and I would urge you to go back to that. In this committee, even when we were in our highest level of Obamacare hostilities, the parts of that bill that related to delivery system reform, the ACOs, CMMI, payment reform, those things have been very popular, and there's been a lot of success across the country with actual cost savings. So I would encourage you, particularly as we close in on a period when Medicare might get like cash negative, to really make that a focus. I think you may find that program integrity is a bit chimerical as a savings device.
Senator, we agree with you that delivery reform is absolutely important, and we are working on that. But let me just persuade you that we can walk and chew gum. As a former Attorney General in the state of California, we did work on program integrity. There is abundant fraud out there, and we can tackle it. And if we don't, then those who are doing it think they can get away with it, and will do more. And so I think we can walk and chew gum and do both areas of reform.
I thank my colleague. Senator Portman is next, and he is online. Senator Portman, you online?
Thank you, Mr. Chairman. Secretary Becerra, thank you for being here. I would agree with what my colleague, Senator Whitehouse, just said regarding the Comprehensive Addiction Recovery Act and its implementation, particularly on the treatment side. We just did provide more funding for that in the omnibus, and unfortunately, with the opioid crisis we have and broader drug crisis, we need to focus even more on the demand side. I'm going to talk to you a little about that today. We have legislation also with Senator Whitehouse called the TREATS Act, and basically it permits us to do something that is working, which is to provide prescription drugs, medication-assisted treatment, in particular MAT, without having to go to a personal in-person visit first. So it's telehealth, and it's worked incredibly well during an otherwise very difficult period during this pandemic. This is one thing that emerging research shows is actually helping, particularly with regard to Suboxone. And it's permitted under a waiver that we have currently, but the waiver is, although, again, very important, and back home folks are calling it a game changer, the waiver is temporary. In fact, the waiver ends when the public health emergency ends. And I'm concerned, as we've been talking about today, that public health emergency would not continue. So what do we do about it? Well, one is you have the ability through HHS to issue a rule on this to permit this kind of telehealth. Again, the research is out there. It works. In 2008, you and I both support it. Actually, I was out of Congress at that time, but you were still in Congress. It was called the Ryan-Haidt Act, which gave DEA the authority and HHS the authority to issue a rule. 10 years later, they hadn't done it, so Congress in 2018 said, please do it, and then again in the Appropriations Act of 2021. So here we are 14 years later, and still we do not have this rule out. Senator Whitehouse and I are frustrated because we can't get technical assistance from your folks on our legislation, the TREATS Act. But my view is if we can't get technical assistance, which we'd like to have, at least if we could get this rule out, it would be helpful to have an administrative decision. So my question to you today is, would you commit to working with Congress to ensure we don't have an interruption in this treatment, particularly really important treatment like Suboxone via telehealth when the public health emergency ends?
Absolute commitment, Senator, to work with you on that. And I have some of my team here, and they heard that admonition you just gave about not being able to get certain technical assistance. We'll make sure that whatever you need, we'll try to get it to you. And as you know, one of these things that makes it more difficult is it's not just up to HHS. We have to work with our drug enforcement partners, and we look forward to your support in trying to get to all the different agencies that have to have a say in this.
Great. Well, thank you. I appreciate it, Mr. Secretary. We will follow up with you right away on that. It's been 2 years, by the way, of us trying to get the technical assistance. And in any case, you have the ability to do the rule, which I think is really important, that we have a law eventually, but immediately let people know that they can continue to get access to this medication-assisted treatment. Title 42 and the border. This is a mess. As you know, we have 7,000 people a day now coming across the border, which is historic numbers. These are unlawful migrants coming to the border and being allowed in, typically under the asylum rules, 7,000 people a day. We are turning away about half the people under Title 42. So another 7,000 people a day would logically be coming in addition to the current 7,000. However, DHS has told us it's more likely to be something like 18,000 a day because folks will come to the border. They're already doing so, apparently, knowing that this Title 42 is going to be expiring. That is moved from a crisis to a catastrophe, I guess you could say, because that's over 500,000 people a month coming across our border who are unlawful. So this is a huge problem. It exacerbates an already very difficult issue we have. Obviously, we need to do something to deal with the asylum policy, which is the underlying problem. But in the meantime, we need more time. I guess my question to you is, I'm wondering why CDC all of a sudden has decided that pandemic conditions have improved enough to terminate 42 when HHS is also asking us for billions of dollars. I think we're about to vote on a $10 billion package of emergency funding to address the pandemic, and you continue to extend the COVID-19 public health emergency, most recently in January, and I assume you'll do it again in April. So you maybe have been asked this already today. I'm sure you have. It's a big concern along the border and for all of us who live in states that are affected by what happens on the border, including the drugs that come across. Any thoughts on that, Mr. Secretary?
Plenty of thoughts, Senator. Thanks for the chance to try to clarify. Title 42 is authority that we have under law to address a health care emergency that relates to the need to quarantine, the ability for us to take measures which otherwise would not be lawful to try to keep Americans safe. That quarantine authority has been used very rarely, and it is for the purposes of something like this pandemic that we've suffered. The public health emergency authority that I have to declare a public health emergency throughout the country applies different law in different ways with different standards. And so that's why you see a different treatment of Title 42 and the public health emergency. What you talk about on the border is one of the conditions that was reviewed for purposes of Title 42. But Title 42 is not an immigration-related law. It's a health care-related law. When the science and the evidence tells us that we no longer need the use of quarantining authority under Title 42 because of health care conditions, then Title 42 must come down. That's why you see the actions being taken by the administration. The evidence based on the science is telling us where to go on Title 42. The public health emergency takes into account many other things beyond quarantining necessity and authorities, and that's why you see a difference. I will close by simply saying this. Using Title 42 for immigration purposes is a misapplication of the law. The President, for his first day in office, sent to Congress a proposal to fix our broken immigration system. That's where we need to go if we want to deal with the border situation that we have, not using a health care-related authority to try to deal with immigration challenges.
Time of the gentleman's expired. Senator Brown is next.
Thank you, Mr. Chairman. Mr. Secretary, nice to see you. 30 years in this city, so congratulations. Thanks for the work you're doing. Just a few things I'd like to mention in your work of lowering drug costs, addressing pharmacy fees. CMS's announcement just yesterday, it'll be covering up to 8 at-home COVID tests for Medicare beneficiaries. Thank you for all of those things. There's a lot to like in your budget. I would like to pick one thing that I know you agree on. You were helpful in this in the House when you were there. Some time ago, 25 years ago, I think, well, more like 25 years ago, Akron Children's Hospital came to the House and asked that we begin something called Children's Hospital GME because they didn't have the dollars through Medicare reimbursement to fund children's hospitals the way that we should. It's clearly the best way to ensure the future of our pediatric provider workforce. It is the single best way to train pediatricians. You know that from your family. You know that from your work. The president's budget proposes $350 million for CHGME, a slight decrease in funding. We had included $375 in the omnibus just passed recently. Well, you work with me and Senator Casey on this committee has been a real leader in other champions here in Congress to make sure we go the right direction, not the wrong direction, since CHGME funding.
Absolutely, Senator. And remember that those numbers that we put out in the budget were based when we thought we would have based on the CR. And so we had to be realistic about where we could go, and the CR was way below what the omnibus is. So don't take those numbers so literally because they were based on what we knew at the time of the budget being prepared, not what ended up happening with the omnibus.
Thank you, and we will count on that because I know your history and I know your heart on this. Cincinnati is home to 2 CDC NIOSH facilities, National Institute of Occupational Safety and Health. 550 federal employees conduct cutting-edge research. It's not nearly as well known as it should be. It's really an institute. There is no facility in the world like this NIOSH facility, where we really do learn so much through collection of data and study about occupational work injuries and occupational work illnesses. And it really is something I'm particularly proud in my state. HHS several years ago set aside $110 million to consolidate and upgrade the current NIOSH facilities into one building or one set of buildings on the University of Cincinnati, bordering the University of Cincinnati campus. Unfortunately, the Trump administration sidetracked it or worse. And we need to make sure that we move forward on this state of the art by any measure. Would share any update on this project today, if you would, to reassure the NIOSH workforce in the city of Cincinnati and workers around the country that this is going forward?
Senator, we're committed to it because there's no way that OSHA can do its work if NIOSH isn't operating properly. And NIOSH has a great responsibility to make sure we're getting real evidence, real data to OSHA so we can make sure that we're protecting workers against the occupational hazards that we know exist throughout the workplaces in America. So we're very committed to it.
Good. Two other statements. One, I'd like you to come visit Cincinnati at some point during this,
Done.
and so you can see NIOSH in person. I
Absolutely.
appreciate that. And second, the president recently put out an executive order in support of the use of project labor agreements for large-scale construction projects like the Cincinnati project. It's my expectation that HHS or CDC, as its proxy, will support the use of a project labor agreement for the construction of this new facility. My staff will be working with your office, with folks at CDC. I'm looking forward to make sure this project, which is about workers, centers workers in its construction and what we need to do.
With you all the way.
Thank you, Mr. Chairman. Thank you, and very good to see you.
Thank you, Senator Brown. As always, sticking up for the consumer. Thank you. Next is Senator Bennett.
Thank you, Mr. Chairman. Can you hear me?
Yep.
Okay, I really appreciate it. Secretary Becerra, I want to thank you for joining us this morning, and it was great to see you in Denver a few weeks ago discussing the important topic of youth mental health, which I know is of great concern to both of us. I deeply appreciate your attention to that. And as you know, and I know you know, rising costs are a concern for many Coloradans and people across the country. We've got a real opportunity to do something this year on prescription drugs. You know, I believe very strongly that we should work to cap insulin at $35 a month. At the very least, we need to make sure we're not increasing costs at this time, which is why we need to extend the advanced premium tax credits that were expanded under the American Rescue Plan. In Colorado, 75% of people on the exchange are receiving financial help to make health insurance premiums more affordable this year as a result of these expanded credits. And if we don't extend them, Coloradans could lose $74 million in support for premiums for 2023. I've seen Congress do everything they can to extend tax cuts for the wealthiest people in the country and for the largest businesses. It seems to me that the least we could do is extend this support for middle and income and low income Americans. Secretary Becerra, could you highlight how important it is for Congress to extend these premium tax credits as soon as possible?
Senator, as you know, there is a cliff that exists for those in the middle class to be able to afford health insurance coverage for their families. There is nothing like having a good quality health insurance plan to give you peace of mind to know that if you ever need it, your child can go to the hospital when necessary. You won't go bankrupt as a result. Extending these tax credits are indispensable in continuing the progress in getting more and more Americans covered. We saw an additional 20 million Americans get health insurance coverage under President Biden's plans, and we want to continue that progress because, as I said, there's nothing like having the peace of mind knowing that you can take your child or a loved one to the hospital when necessary.
But and can you connect that to the tax credit extension?
Well, without the tax credit, many of these families, middle-class families that received affordable insurance coverage under the Affordable Care Act would not be able to hold it because it's too expensive. Yep. And it could be something as simple as getting a small raise in your salary from one month to the next, and that puts you over the top of what allows you to qualify for a tax credit. That's insane. That's the cliff that people fall over. That
is truly insane. And by the way, if you want to inspire people to work, we got to do away with these kind of cliffs. Just in the last couple minutes I've left, Mr. Secretary, we spent a significant amount of time on mental and behavioral health in this committee, and I'm glad that the budget reflects the importance of addressing this issue as a crisis. The budget includes a number of proposals we're considering, including improving Medicaid, which would help the poorest and most vulnerable children and youth in this country. Could you talk a little bit about why we need to make strategic investments to address this mental and behavioral health crisis for young people in this country?
Senator, today, if you were to talk to families across the nation about mental health, about half of those who are parents would tell you that their children, they have had to think about taking their child in to get mental health services, about half. We have seen the numbers skyrocket for ER, emergency room visits by young adults and adolescents, especially among girls. It's a crisis, and we know it's somewhat under the table, but it's a crisis, and we need to start acting now. That's why the President makes substantial investments in this. I will tell you that the more help we have in making sure that we launch well, the 988 national hotline number that will be used to help those who call, whether it's because of suicide or other mental stress, anyone who's thinking about committing suicide, who takes the time to make a call and reaches out for help, should not receive a busy signal or be put on hold. 988 will launch in mid-July. We're putting together this network of detached providers that are out there right now in the country. We want to make it into one holistic approach. 988 should become the equivalent of 911 for mental health.
I agree with that, Mr. Secretary, and I will also say that in Colorado, we are having a mental health crisis among our young people, our adolescents, that is unlike anything that we've faced before. Part of that is COVID, but it's lots of other forces that are tearing at our young people as well, and especially in rural places where there really is no access to services. This has become a huge chronic problem. Thank you, Mr. Secretary. Thank you, Mr. Chairman.
Thank you, Senator Bennett. Senator Daines is next.
Chairman, thank you. Mr. Secretary, thank you for coming up here today.
Thank you.
For 50 years, Title X family planning funding has been managed successfully by the state of Montana's Health Department. In fact, last year, Montana passed a law that prioritizes awarding these funds to comprehensive health care providers like community health centers rather than abortion centers like Planned Parenthood. Last week, your department pulled more than $2 million in funds from the state of Montana and awarded it instead to a pro-abortion nonprofit that has pledged to funnel these funds to Planned Parenthood. This loophole does a runaround Montana state law. It violates the federal Title X law itself, which says that funds cannot be used to support projects where abortion is a method of family planning. This isn't the first time that you've abused taxpayer dollars to get around state laws. Since last year, you also deployed Title X funds to try and counter Texas's life-saving Heartbeat Act. You've told this committee repeatedly you would follow the law. From what we've seen here in these two examples, that's not the case. Mr. Secretary, why should Congress give you a 40% increase in Title X funds that you've requested when you're abusing these funds to get around my state and other states' pro-life laws, contrary to federal law and the will of Montanans who don't want to subsidize the abortion industry with their tax dollars?
Senator, first let me thank you for the way you posed the question, because I know that we all have some very deeply held beliefs when it comes to the issue of abortion. But our beliefs are not the law. We must be guided by the law. And as I said when I was first here for confirmation, we will not only follow the law, but we will make sure we enforce the law.
Has your team reviewed the Montana state law that is very clear on this issue, that prioritized for these exact reasons so that the feds wouldn't come in, pull $2 million, basically usurping the laws of Montana because of a certain agenda that you're driving here relates to abortion?
Senator, with due respect, it's not an agenda. It's the law that we have to follow.
Have you looked at the Montana law? We just passed this law, and you've circumvented the law and pulled $2 million and reallocated it against the will of the people of Montana and the laws of Montana.
Senator, as a federal department, we must abide by federal law. That's what we are doing when it comes to our family planning program money, and we will continue to abide by the law. We respect what a state may wish to do in deploying some of its resources, but we have an obligation to follow federal law.
Well, we'll look forward to further discussions on this as you have gone around the laws of Montana, literally dollars allocated and have been pulled back. I want to talk about Title 42 for a moment. In Montana, we're a northern border state, so you're probably wondering, why is a northern border state raising the question of what's going on in the southern border? Well, it's because we're a northern border state with a southern border crisis. Our communities in Montana have been devastated by the inflow of drugs, particularly Mexican cartel meth, and now fentanyl, as well as heroin. And what's happening is our Border Patrol agents are overwhelmed by the flood of illegals coming across our southern border. It's a zero-sum game. It's a zero-sum battle because the resources are being used to apprehend the illegals coming across, and they can't spend the time needed here to stop the drugs that are flooding across the southern border by these Mexican cartels. With this drug crisis that we see in Montana, it comes as well a massive increase in violent crime, nearly all of which, if you speak with law enforcement on the ground, is tied directly to the drugs flowing across the southern border. Now, instead of being tough on the border, this administration has taken an outrageous step of ending Title 42 removals. There was a border sheriff, southern border sheriff here last week that says we have a crisis on our hands today. Removing these Title 42 provisions turns it into a disaster. It's been widely reported that DHS is making preparations for as many as 18,000 illegal immigrants per day. Mr. Secretary, given the CDC's role in this decision, can you discuss the extent as to which you consider the potential impact of rescinding Title 42 that would have on illegal immigration?
Senator, thank you for the question. And if we focus on what Title 42 is, it is a authority that is granted under statute to deal with health conditions in the country, usually for purposes of quarantining. What CDC had to do in implementing Title 42 is determine whether or not, based on the health conditions in the country, we could take measures which otherwise wouldn't be allowed by law to try to isolate or quarantine individuals. That's the purpose of Title 42. CDC has considered current public health conditions and recent developments within the COVID-19 pandemic and made the decision based on health considerations. What you've spoken to, which you raised some really important considerations when it comes to immigration law and also our border enforcement. Those are not necessarily public health related conditions. President Biden, his first day in office, sent to Congress a proposal to reform a very broken immigration system, but we cannot use a health care law.
And President Biden also rescinded the Remain in Mexico policy when he was sworn in as well, which has been a direct contributor to the flood of illegals we're seeing on the southern border. So I'm out of time. Thank you, Mr. Chairman.
I thank my colleague. And since there was a question about Title 10, I just want to make sure everybody who's following this understands that under federal law, Title 10 can be used for contraception and for family planning. That's under federal law what it can be used for, and we're going to put into the record some further analysis of that. Let's see. Next will be, Senator Langford.
Mr. Chairman, thank you. Mr. Secretary, thanks for being here. This is a long day for you already. We've been popping in and out, heading to votes. You've been trapped in the chair for a while going through this, so I appreciate your engagement. Let me do the unusual thing between the two of us to give you some compliments at the beginning. Can I do that?
Absolutely.
Your team at CMS and their work on DIR fees is something that I have pushed for a long time on this. I am pleased to be able to see that there's actual work going on with CMS in the DIR fees. That's a very big issue, especially for rural pharmacies. Continue to be able to do the work. There are a lot of people that are counting on access to rural pharmacies and other pharmacies based on that work. Just don't allow entities out there to be able to water everything down with what actually needs to be done. Keep going all the way through. Second thing I would say to you is you and I had a banter back and forth about birthing persons last year in your budget. Your budget doesn't use the term birthing persons this year. You use the term mothers. Thank you. You have pregnant people in there as well. That's close enough on it. So I appreciate just the terminology on being able to use that as well. Let me talk through a couple of things on this that I do want to be able to get in on. Switching over, the questions for the record and the responses from your team have been exceptionally slow or non-responsive entirely. I'm not trying to be difficult in some of the questions, but when you were before us last summer, it took all the way until February to be able to get an answer, and when we got the answers, they were non-answers. When we've asked some other questions to be able to follow up earlier this January, we got a non-answer back in March. We've got to be able to get dialogue. So even if you and I just get time on the phone to be able to get answers, we've got to be able to work through answers and try to be able to figure this out. You've been in the House of Representatives. You know what that's like. You want to actually get answers to questions and try to figure out which direction the administration is going. So my first question is really just assurances. Can we find a process that we can actually get answers to questions?
Senator, I hope I can give you an answer that says you're going to get what you need. And why don't we do this? I'll make sure I give you my cell number before this hearing is over so you can call me directly. But we've gotten questions where we've had binders full to answer. It's tough when you get over 400 questions asked, more than 500 different briefings that you have to provide. But having served as a member, sitting where you are, absolutely, we want to be responsive.
Okay, I'll be judicious with that, but let's find a way to be able to just get answers to questions because we're looking for directional issues. Following up with what Senator Daines was talking about with Title 42, this has been used as an immigration policy piece. For instance, the administration came in and changed Title 42 and said if you're coming in with a young child, then Title 42 doesn't apply to you anymore. There is no more pandemic for you. So there are some things that have actually worked it as an immigration policy. I think our biggest issue is at the same time, there's a request from the administration saying we need $10 billion more dollars because of the pandemic. There's also a decision to say the pandemic's over and the risk is over the border, and there's not even a requirement for individuals crossing the border to get a vaccine when they cross. It's made available to them, but not a requirement to be able to do that. I think that's the biggest issue that we're seeing from everybody.
And I won't try to give you a full response, but I'll simply say with regard to children, the reason there was an exception made to children, and by the way, that's been questioned by some courts, is because a child, if not allowed to come in, we have no idea what will end up happening to that child.
Right. These were even family units, though, coming with small children. So it wasn't just a child that was an unaccompanied minor. These were family units of any size that if they had a 4-year-old with them, then they were all allowed to come in. We can follow up on that. I've got 10,000 questions I want to go through. One of the entities in my state had done testing for an at-home antigen COVID test, which they had great responses from in their labs and had a really positive piece. I want to fill you in on what happened on the FDA side on this, though, and the frustration that they've had. They had a very difficult time hearing back from their reviewers. The lead reviewer that they had went on leave for a while, and no one else was assigned to their case, so they had an extended period of time where they got no responses at all. When they start getting responses back, they're asked to be able to send information in by email, but the email servers kick it back and say it's too large, and there was no way to actually be able to submit it online as well to be able to do it. When they finally do get an answer just this past week, after all this long process they've gone through for months, this was the answer they got back. FDA has determined that further review of your EUA request is not a priority. FDA therefore declines to issue an EUA for the product at this time. Here's the concern. The sense is for these at-home antigen tests that are coming out dealing with COVID, that it seems to be the larger companies are getting through the process and the smaller companies are getting this response. This request is not a priority at this time. Tell me that's not so, and how do we able to document that the larger companies aren't navigating the system and the smaller companies are getting from the FDA, you're not a priority?
Senator, thanks for the question. Let me first say that if you wish, we can try to follow up on that particular company and find out where things went. But what I will tell you is when you're dealing with volume in the tens of millions, we do look for those manufacturers that can't produce quickly because those tests are needed now. And so we do try to reach out to those who can give us the volume that we need.
Right. But then again, the manufacturing is not necessarily the company that actually created it. And so that becomes the challenge here. If you've got a really good product on it, wherever it's coming from, how do you turn that around? If you get 100 smaller units that are able to accomplish it, that may be the same as getting one larger one. So we're again back to the biggest companies getting the preference and smaller companies that may have a good product saying you're just not a priority.
scale and efficiency. We'll work with you on that because we want any, especially a domestic manufacturer or provider, to be able to get that out there.
I will have several questions for the record that I'll follow up on. We'll be judicious on how many we give you, understanding you've got several, but there are some issues on gender dysphoria and other issues that are coming up that some decisions are being made that we want to know how that's being made and what's the science behind it, how you're tracking it.
Look forward to getting those
Thank
questions.
you.
Thank you.
I thank my colleague. Senator Casey is next online, and then Senator Hassan, who is here. And I would just urge colleagues who have not indicated either online or in person, we're getting ready to wrap up. All right, Senator Casey.
Hey, thank you, Mr. Chairman. Mr. Secretary, great to be with you again. And let me start by commending you for your public service and the work you do every day and your team does. It is hard work you're doing in a very, very difficult political environment. And I appreciate the work you do and the services you provide to help people across the country. I wanted to start with long-term care, and then I do want to ask you one question, a very specific question about children. But long-term care, of course, is a worry for so many families. So many tens of millions of families worry about this. I know from your own life story, your family has wrestled with it as well. And I know how seriously you focus on this issue. And we know that all of the long-term care challenges we had before are a hell of a lot worse because of the pandemic, just like everything else is worse. We've got to ensure access to quality long-term care. And as you note in your testimony, the administration has been focused on several aspects of long-term care, including home and community-based services for seniors and people with disabilities. We got a good start in this in the American Rescue Plan. We got a foot in the door, $12.7 billion to expand these services. Never been done before like this, by the way. And the American Rescue Plan made that possible. But $12.7 billion is nowhere near what we need to make the investment, to give Americans what they're asking for every day of the week. With a waiting list of almost 1 million people, we've got to pass legislation. I have the bill, the Better Care, Better Jobs Act, and we're going to do everything we can to make sure that this bill is passed or that a policy is enacted into law that incorporates the bill. This is obviously better care for seniors and people with disabilities in the place they want the care, either in their home or in the community. It's also, of course, better jobs and better pay for the workers. We can't have the best caregiving in the world if we're paying workers $12 an hour, and that's the reality in America today. In addition to the home and community-based services, I've been working with Senator Toomey on legislation that focuses on the Special Focus Facility Program, where we've tried to shed light on cases of abuse and neglect in the small number of underperforming nursing homes. We have legislation to do that. I saw that the administration has a 24% increase in funding for oversight for these oversight of nursing homes. So that's my question. How will these appropriations or increases in appropriations toward nursing home quality and oversight be beneficial to better protect residents?
Senator, by the way, thanks for your longstanding work on these issues. And what I will tell you is, as you know, that there are a lot of these service providers, these facilities are doing their darndest, and COVID made life even more difficult for them. And it's tough to find the professionals that you need that are qualified, tough to pay them properly. All of those things add up. And then, of course, you have those that don't try to provide that service with quality and that are cutting corners. And that's where we're going to do much more in oversight and in surveillance. The budget, as you said, reflects that with more than a 20% increase in funding to make sure we do that. And we're also trying to provide more services and resources so that we can actually help increase the pay of those workers that do indispensable work with our loved ones. And so we look forward to working with you, whether it means moving more of the services towards community-based, home-based services, or whether it makes sure if you're going to go to a nursing home or some facility that may not be so close to home, that you're going to receive quality services for your loved one.
Thank you, Mr. Secretary. I wanted to ask you a question about what the administration is doing to track and support children who have lost a caregiver and how we can better support family members in this circumstance. We've got 200,000 kids in the United States who have lost a parent or a primary caregiver due to COVID-19. Research shows that unaddressed childhood grief and trauma can lead to difficulties like decreased academic performance, mental health issues, and early mortality itself. What can you tell us about the administration's efforts in this area?
Senator, it's a tragic story. As you know, tens of thousands of children in America have lost their primary or secondary caregiver as a result of COVID. What we're trying to do is make sure that we provide services to families, whether it's that home or community-based service, that makes it possible for the child to receive at-home services with quality. We're also trying to beef up the support we provide to those kids who have to go through the foster care program, because we know there we find a lot of kids are falling through the cracks. We're going to make an emphasis as well on those kids who are aging out of the foster care system to make sure that there's continued resources even after they have to leave the foster care program and be on their own. And so we're going to continue to make investments. This particular budget, as we've discussed over the course of this hearing, the investments on mental health services, substance use services, all of that is focused to make sure we get people back on the right track.
Mr. Secretary, thank you. Mr. Chairman, thank you.
Thank you, Senator Casey. Senator Hassan.
Well, thank you, Mr. Chairman and Ranking Member Crapo. And Mr. Secretary, thank you. Yes, you've been here for a good couple of hours now, so thank you for your patience and your service. I want to start with a question about medication-assisted treatment. Healthcare providers in New Hampshire and experts before this committee have made clear that medication-assisted treatment is critical for individuals with opioid use disorders. With medication-assisted treatment, more people can enter and remain in recovery. What is the Department of Health and Human Services doing to expand access to medication-assisted treatment?
Well, we've been working with our partners in the Department of Drug Enforcement and the Department of Justice to make sure that we can move forward, because we've seen the data proves it. Right. The science and the evidence show that medication-assisted treatment works. And so we want to make sure that we give providers the flexibility to offer that treatment to a lot of folks who will benefit from it. So we're going to be driven by the science and the evidence, working with you, and thank you for all the work you've done on this to make it possible for folks to recover.
Well, that is good to hear. There were obviously restrictions lifted and some flexibilities granted during the pandemic, and it sounds like you're going to continue to work with the DEA and states to make sure that we could perhaps make some of those permanent, again, based on data.
Absolutely.
Thank you. As drug prices soar, granted staters are rationing life-saving medications because they can't afford them, choosing between filling their prescriptions and putting food on the table. One of my constituents stopped taking her blood pressure medication for periods of time and suffered a stroke and is now in long-term care, something she was hoping to avoid as she aged. Congress has to take immediate action to cut drug prices. How would allowing Medicare to negotiate drug prices save money for patients and reduce federal spending?
Well, Senator, as you just pointed out with one of your constituents, not taking medication as needed, that's so common. 1 in 3 Americans have reported to us that they don't take the medication they're supposed to because they can't afford to continue to use it up as quickly as they would. And so we have to do something. We are ready to use whatever authorities we have. We don't believe we have the kind of authorities that won't send us to court to be able to do as good a job as you all could do to change some of the law, to give us more authorities. But if we were able to, for example, negotiate the price of drugs, the way you negotiate the price of a car, the way you negotiate the price of that mechanic bill, there's no reason why when something as important and precious as a medical service or a prescription drug, you can't get the best price for your patient or your loved one. Give us that opportunity through Medicare, and we will lower the price of prescription drug medication for Americans.
Well, I hope we can find bipartisan support to do just that. Thank you for your commitment to lowering the cost for prescription drugs. I want to move on to the issue of Title X. State laws restricting women's capacity to make their own health care decisions and, frankly, chart their own destiny are forcing some family planning centers to close and others to serve entire regions using very limited resources. New Hampshire state government recent decisions to reject federally funded contracts to some family planning centers is going to make it harder for centers to serve their patients. How have state anti-choice restrictions influenced the budget request for family planning funds?
Senator, first and foremost, we must enforce and comply with federal law. And under federal law, family planning services should be available to families who qualify. We're going to make sure that we provide that service, including contraception services, to families throughout the country. We respect what states wish to do in terms of how they implement their particular laws and their enforcement and administration of their services, but we have an obligation to make sure that under our laws, our federal laws, no one is discriminated. And so we're going to make family planning services available to everyone who qualifies under federal law.
Well, I thank you for that commitment. That's why I'm working to increase Title X funding in the fiscal year 2023 appropriations bill. I look forward to working with you to make sure that that happens so that we can support these critical services for women in New Hampshire and all across the country. A quick question about child care and Head Start. The Office of Head Start and the Office of Child Care operate two very different but equally important programs to support early learning. Combined, these two offices help more than 2 million children access affordable child care across the country each year. How will HHS most effectively use the current proposed budget increase to ensure that these two agencies work collaboratively to serve as many families as possible?
Senator, one thing I can tell you is that we wish to have those services be as seamless as possible. So whether it's early Head Start program, or whether it's just child care for the infant toddler, we want to make sure that throughout that process, a family knows that their child will get the best care and educational services possible. So we're going to try to be as coordinated as we can to make that as seamless a process as possible.
Well, I appreciate that very much. Thank you, Mr. Chair.
Thank you, Senator Hassan. Senator Warren.
Thank you, Mr. Chairman. So President Biden has created a record 7.9 million jobs, more jobs created in the first 14 months of any presidency ever. But even as we're trying to get our economy and our lives back to normal, families are getting hit by rising prices on essential goods, from gas to groceries. And as Americans are looking to get out and about again, to go back to restaurants and bars and gyms and movie theaters, those businesses are struggling to find enough workers to meet the surging demand. So now economists are warning that inflation could spread from goods to services, especially if we don't get more workers into the labor force. But one of the big things that's holding back the labor force participation is a shortage of affordable child care. Secretary Becerra, when parents can't find affordable child care, how does that affect parents' ability to work and, in turn, businesses' ability to hire?
It brings things to a halt. It grinds to a halt, and you're stopping productive Americans from getting out there and helping businesses be profitable and prosper. It makes it very difficult for our economy to continue to be the leader when you can't get people who are qualified to get out there and work.
Yeah, well, you make a good point here. The American economy relies on working parents, and those parents rely on childcare to be able to go to work. But even with record job creation across the economy last year, the childcare industry is still down 136,000 workers compared to early 2020. So, Secretary Becerra, there is clearly strong demand for childcare. Why isn't supply rising to meet it? Why hasn't the market solved this problem?
Well, if it's left in the private sector's hands, it becomes unaffordable for most families, including middle-class families, to afford. You're paying essentially college tuition to care for your 2-year-old child. At the same time, states, with the support of the federal government, have been providing subsidies to help child care providers get out there and offer those services. Here's the difficulty. As you mentioned, some of the workforce is getting paid some of the lowest wages. We need to increase that because those folks are now seeing, I don't have to do this job. I can go make more money flipping burgers. We have to increase the wages that we pay to people who are essentially caring for the next generation of leaders. And at the same time, we have to be able to expand the size of the care facilities so that they can take in more kids from these families. And so the proposal in Build Back Better actually made some of that possible. I hope that we're able to succeed in getting some of that across.
So let's just unpack that, though, a little bit in what you're talking about here. Child care providers are operating on razor-thin margins. They just simply don't have the money to pay their workers more than those workers could make right now by just moving over to McDonald's or to the gas station down the street. That means the child care center can't hire staff, and that means their economy doesn't have the child care slots that it needs for parents to be able to get back to work and our economy to get back to normal. So let me just ask, I think you've already referred to this, but let me put the question to you directly. Do you agree that to fix this problem, federal investments in child care are essential, not just for tackling higher costs for families with young children, but also for reducing the drivers that are raising costs economy-wide?
Without a doubt. Just for the same reason we have public education in this country. We realize that if we left it in private hands, very few parents would be able to afford to send their kids through K through 12. The same thing applies to child care. We need to be supportive because there are caregivers who are trying to do the best job they can, but they're overwhelmed.
In other words, whether we have children individually or not, we all have an interest in making this economy work, and child care is part of making this economy work. Is that fair?
It takes a village.
Well, thank you very much. You know, this is a critical moment in our economic recovery, and we need to make these investments in child care in order to keep our economy on track and to fight back against inflation. Investments in child care will help lower costs for working families and will help boost our economic recovery by ensuring that parents can go to work, preventing a labor shortage and preventing further inflation. These investments just can't wait. American families can't wait. Our economy can't wait. So I hope we can get this done and get it done soon. Thank you very much for your work on this, Mr. Secretary.
Thank you.
Thank you, Senator Warren. Mr. Secretary, you've been very patient. We appreciate it. There's just one issue left that is really important to Oregonians, and I've got to ask about it. And that's this question of the pharmaceutical benefit managers squeezing these pharmacies. And we have seen it all across Oregon. As you know, Oregon is not alone. This is happening, everywhere. And essentially, you have these small pharmacies, like the one I visited recently in southern Oregon, who have the PBMs and the insurance companies come in long after the sale has been made. In one instance, I was told about a year after the sale was made, and it's almost like the PBM says, gee, we're not making enough money this year. We're just going to come back and tell the pharmacist, you've got to send us another big chunk of money. And the idea that in America, after you've purchased something, in effect, you've had a point of sale. You're an attorney general. I mean, that's just kind of basic consumer protection law. You're not allowed to just come back, months and months, and in this case, a year, later. And this rise of what has euphemistically been called direct and indirect remuneration, or, quote, DIR fees, just strike me as an absolute ripoff. And I see the pharmacists not being able to make these payments, which hurts the consumers, particularly in underserved, areas. And you have this spiral that leads, as I've seen over the last few months, folks just waiting in line because the existing, pharmacies suddenly have all these new people who will deluge the facilities that remain. And your CMS director, Chiquita Brooks-LaSure, in my view, is really doing good work in terms of trying to get some protection for folks and to get a point of sale rule so that these PBMs couldn't come back and just indefinitely squeeze the small pharmacy. And I would just not be accountable to my constituents where this issue is front and center, particularly in rural communities. Our state legislature is focused on it. I wouldn't be accountable to my constituents if I didn't ask you where we stand on this. And I want you to know that your CMS director has been very responsive to my questions. I just would like, before we wrap up, to get a sense of where we are with things.
Mr. Chairman, probably the best thing I tell you is stay in touch with Administrator Brooks-LaSure, because we're trying to move as quickly as we can on this. Everywhere I go, and I've gone to a lot of community health centers, a lot of places dealing with vaccines and so forth. Everywhere I go, I always get tapped on the shoulder by someone who says, can we really deal with this? Because it's making it not only impossible for us as a provider or a pharmacy to dispense, but it makes it tough for us to help those families who need those prescriptions right away. And so we want to tackle this, but as you know, this is an issue that's been around festering for years. I think CMS is going to try to move as quickly as we can. I suspect we're going to find ourselves in court at some point or another, but we're going to move because it's too important to make sure we dispense these medications that people absolutely need.
There is unquestionably a powerful lobby out there for business as usual. And I just want to raise, I've been visiting a little bit with my friend and colleague, Senator Crapo, because we have lots of these small pharmacies. The PBMs clearly had a role 30 years ago when people didn't have all the data that's out there now about pricing, and there weren't people who could use it all. But somehow the PBMs just seem unwilling to change. They just want to do business as usual along the lines of what I described in Oregon and what you have people, in your words, tapping you on the shoulder when you show up, for example, in a small town in Ohio or West Virginia or Montana, where people all have these kinds of concerns. So I just thought it was fitting that we wrap up. We thank you very much for your taking this time to bring us up to date on the administration's priorities. And I just wanted to wrap up with an issue that really has a human face in communities all across the country. And I can see that you're very much aware of that. And we look forward to working with you on this issue and others. From our rules requirements, questions for the record are due to the committee on April 12th at 5 p.m. I also want to thank my colleague, Senator Crapo, for his assistance, especially this morning, but on so many things. And you could probably tell as you take off, Mr. Secretary, how committed the members here on both sides of the aisle are with respect to the mental health issue, which we will also be working closely with you on. With that, the committee is adjourned.